Hello everyone. It gives me great pleasure to be presenting at this conference. My name is Dr. Zahraa Mansoor and I'm a pediatric resident working in Dubai. I'll be presenting a clinical audit that I conducted in my hospital titled A Questionnaire to Assess Nursing Compliance to Practices Related to Central Line Care in Our Hospital to prevent and reduce the rates of central line associated bloodstream infections. I hope you enjoy my presentation. This clinical audit was conducted by the surgical department in my hospital. Just a bit of a background regarding this topic. Central venous catheters, or CVC, play an essential role in the management of patients with chronic medical conditions who require complex care. They are highly imperative for regular medication administration and blood sampling when it is difficult to gain or maintain a peripheral access, and for delivery of specialized treatment such as hemodialysis and parenteral nutrition or TPN. Despite their utility, these devices predispose patients to various complications, including the risk of a central line associated bloodstream infections, or, as I will be referring to in my presentations, CLABSI. Typically, non-tunneled catheters are more susceptible to CLABSI, and this risk is further increased by long duration of indwelling, extensive replacement, frequent repositioning, and poor handling. CLABSI are most commonly caused by gram-positive organisms and are considered a major cause of prolonged hospitalizations and increased mortality. Pathogens responsible for causing CLABSI include Coagulase negative Staphylococcus for 37.8%, followed by Enterococcus, which account for 11%, Staph aureus, followed by Enterobacter, Candida, and Pseudomonas aeruginosa, and finally, Klebsiella pneumonia. The Center for Disease and Control Prevention, the CDC, has developed guidelines for the prevention of CLABSI. At the bulk of those guidelines are recommendations for nurses regarding handling and maintenance for central lines in an ICU and non-ICU settings. Before starting the clinical audit, we set a couple of objectives. Our objectives were to assess awareness and perceptions of policies and practices related to CLABSI prevention within the nurses in our hospital, and to implement a surveillance program for central line associated bloodstream infections, and finally, to determine if compliance to these preventive measures will reduce the risk of CLABSI. Regarding the methods, we first came up with the audit plan. So we adopted the CDC guidelines for handling and maintenance of CVCs and assessed the compliance rate by distributing an online questionnaire to all the nurses involved in patient care. The questionnaire consisted of 15 questions, which assessed the awareness and compliance of nurses to those guidelines, and how often did they adhere to them. Regarding the guidelines, the questionnaire was based on the 2011 CDC guideline for prevention of intravascular catheter-associated bloodstream infections. Those guidelines targeted healthcare professionals responsible for handling, surveillance, and control of infections in hospital, outpatient, and home healthcare settings. After distributing the questionnaires, we got the results of the first cycle. The first cycle involved 32 nurses from the inpatient pediatric wards in our hospital. The results of their compliance to each specific guidelines were as follows. So those are the results that we found presented in the table below. The highest compliance rate was to changing dressing using aseptic techniques with clean and sterile gloves, while the lowest compliance was to using peripheral sites prior to using the central line while collecting blood cultures. So the guidelines included: are the central line maintained and accessed only by trained personnel who have demonstrated competency, for which it showed 90% of compliance. The second guideline was regarding hand hygiene and if it is performed before and after replacing, accessing, repairing the catheter, and there was a compliance of 96.9%. The third guideline was regarding catheters and if the catheters were accessed with sterile devices, for which the nurses showed 93%. The fourth was regarding access ports and if access ports or tubes were scrubbed immediately prior to the use with an appropriate aseptic chlorhexidine, and it showed 93%. 100% compliance were for the guideline regarding dresses and if dresses were changed using aseptic techniques and using clean or sterile gloves. The six guidelines consisted of: is clean skin prepared with chlorhexidine with alcohol during dressing changes, and it showed 81.3%. Number 7 was: are dresses that are wet, soiled, immediately replaced, for which it showed compliance of 87%. Next is regarding temporary central line. Are the gauze dressing changed every 2 days or semi-permeable dressing at least every 7 days, for which it showed 81.3%, and so on. So those were the guidelines that we used during in our clinical audit, and the nurses were specifically asked about those guidelines in the questionnaire. Presented here are pie graphs showing compliance to each guideline. Figure 1 shows 96.9 compliance to guideline number 2, which insisted on hand hygiene. Figure number 2 showed 81.3% compliance to cleaning the skin with chlorhexidine during dressing changes. Figure number 3 showed 81.3% compliance to changing the gauze every 2 days or transparent dressing every 7 days, while the last figure showed 78.1% compliance to replacing administration sets every 4 days. And it showed that our hospital had very good results and very good compliance rate to the guidelines that are put in order to prevent central line associated bloodstream infections. After finishing the audit, we came up with a couple of recommendations to help the nurses to improve their practice and therefore decrease the risk of infection and increase the risk of morbidity and mortality among our pediatric patients. The recommendations were: the central lines should be only maintained and accessed by trained personnel, and to disinfect catheter hubs, needleless connectors, and injection ports before accessing the catheter, and that administration sets used for patients with prolonged hospitalizations should be replaced every 4 to 7 days, and to pay closer attention to the dressings and the area around it. Dressings that are wet, soiled, or dislodged should be immediately replaced. To use chlorhexidine containing dressings for central lines. To use antimicrobial locks for central lines. To assess the need for continued intravascular access on a daily basis during multidisciplinary rounds, and to remove non-essential catheters. To ensure appropriate nurse-to-patient ratio and limit the use of float nurses in the ICU, and to perform regular surveillance for CLABSI in ICU and non-ICU settings, and measure the unit-specific incidence of CLABSI. So these recommendations were outlined in a leaflet, and then the leaflet was distributed among the nurses for them to follow the new recommendations that we came up with after conducting the clinical audit. Next was the second cycle of the clinical audit in order to perform a closed loop audit. So a leaflet containing all the above recommendations was distributed to all the nurses involved in handling the central lines. They were advised on proper central line care techniques to reduce the risk and prevalence of central line infections. The head of infectious disease department was informed regarding deficiencies in our hospital guidelines. A second questionnaire was performed and distributed to the nursing staff, and it showed significant effect and improvement in adherence to the guidelines by 60%, which reflected a very positive outcome. We have also contributed to the development of strategies that increase adherence to the local guidelines. So we had a very positive outcome as a result of our clinical audit, and we improved adherence to the guidelines and therefore improved the practices in our hospital and decreased the rate of infection. Those are the references that were used in the clinical audit, including the CDC guidelines that were used. Thank you very much, and I hope you enjoyed my presentations. Thank you.